Thank you, Mr. Chairman. I do appreciate the opportunity to testify about my bipartisan bill, the Promoting Responsible Opioid Prescribing Act, or the PROP Act. My home state of West Virginia has the highest rate of opioid overdose deaths in the country, more than double the national average. This drug abuse epidemic is a tragedy crying out for action. Addictions ravage our communities, rips families apart, stunts the development of our youth, and harms our economy. The House has already taken some important steps to address this epidemic, but much more remains to be done. One solution is my bipartisan bill, the PROP Act, H.R. 4499. This bipartisan bill removes a harmful provision of the Affordable Care Act that places unnecessary pressure on doctors and hospitals to prescribe narcotic pain medication regardless of whether the patient actually needs it. This problem was first brought to my attention by a group of doctors in Charleston, West Virginia, and I thank them for that. These doctors, many of whom serve Medicare patients, described the dilemma they face when treating pain. Either prescribe narcotic pain medicine to patients who do not need it, or risk receiving a low patient satisfaction score and a subsequent cut to the reimbursement rates. This dilemma is a result of a well-intentioned policy that is having unintended negative consequences. In 2006, the Center for Medicare and Medicaid Services, CMS, and the Department of Health and Human Services, HHS, developed a survey called the, quote, Hospital Consumer Survey of Healthcare Providers and Systems, close quotes, we know it as HCAHPS. HCAHPS is a standardized survey used to measure patient perspectives and satisfaction on the care they receive in hospital settings. At first, hospitals use the survey on an optional basis. However, when the Affordable Care Act became law in 2010, it put in place, quote, pay-per-performance provisions that use these survey results as a factor in calculating Medicare reimbursement rates for physicians and hospitals on, quote, quality measures. The survey includes 3 questions related to pain management, including one that asks whether patients feel that their caretakers did, quote, everything they could to help, close quotes, with pain. While these questions are clearly intended to help patients, doctors tell me that these questions pressure the doctors to overuse prescription pain narcotics when treating patients. At a time when prescription pain abuse is rampant, this is deeply concerning. Doctors, not the federal government, know best how to treat patients. And that includes the question of how best to use narcotic pain medicine. The PROP Act would remove the 3 pain management questions from consideration only when CMS is conducting reimbursement analysis. However, the patient will still answer the pain management questions in their HCAHPS survey so hospitals can monitor how they're doing. By severing the relationship between HCAHPS question on the pain management and reimbursement, we can remove undue pressure on doctors to prescribe unnecessary opioid medications. This simple change will reduce access to narcotic pain medication for patients who do not need it, thereby reducing the risk of addiction. According to the National Institute on Drug Abuse, people who abuse opioid painkillers are 19 times more likely to start using heroin than people who do not abuse those painkillers. In addition, CMS is fully able to implement the PROP Act. The agency has already provided my staff and this committee with technical assistance on the bill. If the bill passes, CMS will simply remove the questions from reimbursement calculations during the next rulemaking session. I'd like to thank the staff from this committee for their help with that. The PROP Act is also broadly supported by groups active in this field, including the American Hospital Association, the American Medical Association, Physicians for Responsible Opioid Prescribing, Association of American Medical Colleges, and America's Essential Hospitals. It's also been introduced in the Senate by Senators Johnson, Manchin, Capito, Barrasso, Blumenthal, Markey, Toomey, Ayotte, and King. Finally, I want to thank many members of the Ways and Means Committee who are already co-sponsoring the PROP Act: Tom Price, Diane Black, Tom Rice, Pat Meehan, Earl Blumenauer, and Bill Pascarell. Thank you, Mr. Chairman. Your consideration.
Thank you, Mr.